So low back pain is the number one reason why people across the world go to doctors. And so this needs to be addressed because it's not being addressed well. And so what is one of the first things that we need to do? Science talks about this wonderful idea of proprioception, interoception, these two kind of ideas. Basically, proprioception means our sense of knowing where our bodies are in space. Interoception has more to do with being able to sense what's going on inside of us. Both of these are important, as you can imagine. So the thing that I want to work on today is just starting to wake up that part of ourselves, that part of our system. To do that, just imagine that if we have pain, if we have low back pain, there's two things always happening. There's something going on in our bodies, in our physical bodies, that are sending particular messages up to the brain, basically signals saying, check this out. And if the brain interprets those signals as, ooh, there might be something there from a predicament in our past, or there might be something there being able to predict the future, because our brains are really good at that, then we might feel pain. And so to take that's part of the neuroscience around it, right? But we want to get to what can we do that's practical? What can we do that's practical? This is one of those things that we can do, is just start to connect into our nervous systems a little bit more. Start to connect so how do we do that? By bringing input into the body. What kind of input are we going to do today? We're just going to do tapping. We're gonna access the mechanisms of touch and pressure, just starting to wake up our system. So this is something that for me is really kind of essential at the core. In my experience, because I've done these things when I was younger, I realized that I kind of organized this in my mind that, everyone must have this accessible to them. But that's not the case, because a few months back, a friend sent me a link to someone who was doing, a little bit of what we'll do today. He was doing, basically these tapping exercises. And I was like, that's strange. Why would this help him? I asked myself, why would this help my friend? And it was because he doesn't have this kind of connection to his body. And so this is just stimulating, bringing input into the nervous system, gives the brain some information that it wants, and it starts to calm down, right? It starts to calm down just because of that. The brain is wanting information. It wants to know, right? Whether on a conscious or a subconscious level, mostly on a subconscious level, it wants to know. So let's give it something let's feed it something that it can begin to digest. Let's feed it something that helps it feel connected, feel safe, feel complete, right? So that is just going to be tapping, and we will start. We'll start in simple ways, from the head down, right side, left side. So we can just start by kind of tapping on our heads from front over the top to the back, right? Just getting ourselves to kind of wake up on that side. So do that with me here, from the top to the side, from your face to the back of your head. Let your ear feel it. Let your jaw feel it. Do this. And we'll even go under that jaw, just so that you begin to feel, your brain begins to sense your body and where it is in space, right? Like right now, as I'm tapping my face, as I'm tapping my head, I can feel those areas. They kind of like are coming to life in my brain's experience because they're getting messages, they're getting signals. And so the brain is like, oh yeah, I feel that area. I get to experience all that. But other parts of my body that are still don't have that same luxury, that same connection with the brain. Okay? And so just doing that and pause for a second and feel, is there a difference between the right side of my face and head compared to my left? Yeah, this is very different. It's kind of awake. It almost feels bigger. We'll talk about that down the line when we talk about the homunculus in the brain, or basically the map of the body that's inside the brain. We'll talk about that, okay? So after that, let's go to neck. Let's go to neck. We can do that with our right hand. We can do that with our left hand. Crossing the midline is a good thing to do. You can go forward to back. You can go back to forward. And just getting a sense of like, oh my gosh, I don't ever touch my throat. I never touch my trachea. I never touch my voice box. I never touch that root where my tongue is connected even, right? Our bodies need input. Our bodies need input. Our brains need our bodies to have input. And it doesn't just stimulate that, but it must stimulate a lot of other things, right? Like the difference between if you call your friend and you say, hey, Aaron, right? If you say, hey, Aaron, with your voice, that's a lot different than if someone puts their hand on your shoulder, taps you and says, hey, Aaron, right? Those are different. It's a different experience, but there's more confirmation when a person actually touches you along with your voice, right? Okay, so let's go to shoulder here, just kind of neck, upper back, shoulder, right? Neck, upper back, shoulder, kind of percussion. Almost a mini perturbation of your nervous system here. You can see my shoulder trying to come into it and help out, but I actually want to relax that because that tension kind of prevents things in a way. Let's go on the outside of the arm, down your fingers. You can go at different speeds. You can go on, use different strengths of input. Tap harder or lighter. Let's go on the inside of that armpit. Let's do that a few more times. Breathing into it as well as we're going. And then just relax. Just kind of get a sense of your body. And if a lot of times when I'm doing this with clients, and I'll say, just check in with yourself. And they'll be like, yeah, I might feel a little bit, especially if this was their first time doing something like this, I might feel a little bit of difference. There might be something there, but it might be placebo, or because you asked, I might have a heightened awareness, or I might be making things up in my mind. I get that. Those are all questions. They're valid. They're good. It's good to ask those questions, right? But I think from my experience, just becoming aware, noticing, allowing yourself to sense something, giving yourself the license to feel, right? A lot of people are not feeling because we're so busy doing other things in the world. We are so busy, whatever it is, paying our bills or doing this or doing that or being with this person, that we forget ourselves. We neglect our own selves. So now we'll go into, the front of our bodies here. Wow, that's very different. What's your experience here? Whoa. This is the right side of my body. It might be flipped on the video. This is the right side of my body, but what are we contacting here? Not just chest, not just ribs, not just diaphragm, abdomen, but we're also putting some percussion into the organs as well. So what do we have here? We have lung, we have a little bit of the heart, diaphragm, we have liver, gallbladder, small and large intestines. We have kidneys in the very back, right? We have the front of the spine. We have the nervous system. We have the arteries and right the aorta, the vena cava, the different vessels that come through here. The spine, spinal cord, right? All of that stuff is kind of awakening. You can almost imagine like me and my kids were holding our snake this morning, and when the snake was in its cage, it was still and it was just hanging out under the heat lamp. But when we took it out, it started to move, and that's how our body, let's pause for a second and just allow ourselves to feel that part of our body, even moving in space. Like, wow, what does it feel like when I move this right side of my body compared to the left? It's a little bit different. It's a little bit different. Not a whole lot, but remember, in the body, millimeters in the body are like miles in the world, right? So it's important to just get a small sense of, right? Just get a small sense of what's going on in here. Make minute changes, minute connections, because over time, those are huge, those are big. So again, what does this mean for me after, having done this when I was younger? This means things like, wow, I can almost do this to myself just by a thought or an intention, where someone else might be like, whoa, that's a significant shift. There's a significant, I've never done that before, right? And that actually feels kind of good. We can do this and stimulate kidney back here and all the different, muscles of the back, upper back, mid back, low back. Low back, again, this is mostly about low back pain, but in order to really help our low backs, we need to help our whole bodies. We need to help our brain understand and have connection again. When I go into my low back, and I'm a low back person, right? I got into this work because my low back was really an issue. And it still comes up for me. And it comes up for me most when I become oblivious to my patterns, when I forget, when I work really hard and I neglect things that I need to do to keep healthy in my back, to keep resilient, to keep novel movement coming into my system. It's not just brain stuff. It's not just about what I think about my low back, but it's also what I do with my body. That's a huge part of it, right? So neuroscience is great because it both invites us to new information that's more precise and intellectually and our understanding of things, but it also invites us into our bodies again. So let's just pause there now, get into our bodies, feel what that feels like. Wow, cool. So just stimulating the nervous system, stimulating the body, stimulating the brain. It's almost like, let's go down our leg here. Let's go down the front, up the front, down the back. What does it mean to tap? How do you tap? Those are good questions too. How do you tap? We'll go into a little bit more of that, more detail, when we talk about counter movement. But right now, we just want to tap on those things that are tight. Almost get a sense of the 3 dimensions of your muscles, of your body, of your bones. right? Again, this helps to wake us up. This helps to wake us up. Wake our nervous systems up so that our brain starts to see our body in space. Okay, let's go all the way up now. Down, down, and up. Let's go up, over, down the back, up the front. You can even go into hip, side of hip. And take a break and feel that. You know, again, this might be something that maybe just takes the edge off some of your back pain, but I want you to work with it. I want you to play with it because, and let's go head. I want you to work with it. I want you to play with it. I want you to get creative with just kind of tapping. And there are systems of tapping, right? There are systems of tapping out there that are like, oh, if you tap these areas, if you tap these points, then you'll get rid of these types of health issues. Yeah, that's cool. You know, maybe there's something to that. I've studied some of those, you know, some of the tapping sciences, and they've actually been very amazing. However, I didn't always get consistent results with them. And so I do believe that tapping is important, but maybe not tapping in the way that, you know, I don't think there's only one way to do everything. I think it's good to have techniques. I think it's good to have, practices, consistent things that we do. But I think that novelty and doing things differently is also very important. So, you know, because if any one system was everything, then we would already be fixed. So I do believe in a more holistic approach. I believe in a more universal, like, hey, let's take information from all these different sciences and gather them together and use them, right? I think that for a lot of people, we've been too modality-centric and not client-centric enough. And that's where one of my big issues is with all of medicine right now. It's like, yeah, we have really focused on understanding our individual science and laws, regulations, jobs. They tout that, right? Becoming an authority in something. But becoming an authority in one thing without having the big picture as the constant model that you're looking at and using and trying to get to as the goal, right? I think that creates a lot of problems, short-sightedness, and maybe even, what do you call it? Sorry, it was down the back. I like to go down the back, up the front. I guess I would call it, I don't know, like a caste system, right? If you know this, then great, and you get paid a lot. You get accolades. You get, people revere you. But to me, reverence needs to go to not just the one who can do amazing, some amazing things, but the collective. To me, the collective of people and our collective knowledge and our, let's go into this back. I missed the back. Our collective knowledge, our ability to help each other, close the gaps in what we know or what we don't know, right? Sharing. I think a lot of what sort of this over focus on specifics, over focus on specialists. Specialization is great. I think it's wonderful. I think it's one of the most important things. But I think the goal that we should never lose sight of is to always continue to see the whole and put this whole thing together, right? So now when I do this, get into myself, that feels like, that feels like the edge is taken off. I feel like more connected into myself. I can even walk and do these types of things, right? For me and for most people, we're going to have an issue in what I call the eggshell. That is diaphragm, abs, glutes, pelvic floor, glutes. And diaphragm is an important part of the whole thing, right? Because we will talk about that in another video. But just kind of developing or renewing the proprioception in your body through tapping and giving your brain information from your nerve, from your body is really important. Now check that out. Feel your body, feel your pain. And what I want you to get from this video is that, again, we have historically and even currently, we are so focused on modalities. I'm a massage therapist, I'm a chiropractor, I'm an acupuncturist, I'm a doctor, I'm a this, I'm a that. This person is a this and a that. They've went to school for years. We need to sort of, yes, we want to respect all those people for what they've done and the experience that they have, but we want to give clients sovereignty, right? Not the modalities, not the authorities. The authority is there to help you and guide you, maybe even provide you with things that you can't get on your own, but we need to do as much as we can to elevate the agency of clients. So we need to be more client-centric. All of these different modalities, whether it's, psychotherapy or physical therapy or whatever type of therapy, really they are all supposed to be giving you agency back, giving you your body back, giving you information where you can help yourself, right? That should be the underlying goal of every healthcare practitioner, is to give you what's going to be helpful for you, all the tools, all the information, all the things that will help you. If they're not doing that, then they're doing a horrible job and they're keeping you confined by their authority. They're keeping you confined by keeping you limited in your knowledge, by keeping you limited in, I don't think I can do that. Let me go see my, put whatever therapist or healthcare practitioner you want to put in there. Everybody feels like they need to see there. It's like, there's truth to that sometimes, but the majority of the time, learn to take care, learn to connect, learn how to relate to this world that's full of stress or full of this or full of that, and process that in your body so that you don't harbor it. Your body shouldn't keep the score of all the trauma, stress, and difficulty. Your body should be a sanctuary. It should be a place where you feel the most comfortable in this world. It shouldn't even necessarily be the confines of the walls that you own, the walls that you have, the car that you have, the money that's in the bank account, the relationships you have around you. The most important relationship, and don't let anybody tell you different, the most important relationship is you to yourself. You to your body. Once you don't have a body, you can lose everything. But once you lose your body, then it's end game, right? It's off. So that's it for today. Is just play with and be interested in it. Right now, at this level, we don't want to focus on being fixed. That is the old model of things. Don't worry about things will become fixed. Things will get fixed. Things will, but we're human beings. We are in a constant process of evolution. It's like once something gets good, guess what? Another issue is going to come up that we have to figure out and solve. And so don't think in terms of like, if I can just fix this, because our brains, remember, pain is an interpretation of what's going on in the body by the brain. It's an interpretation. So it's not even always accurate. It's not always accurate. It's not always precise. And that is a hurdle to get, that's a mental hurdle to get over, but we need to get there so that we can start connecting and owning and healing our bodies and being good with it and understanding what the pain means. That's a whole other video. We can go over that, but hopefully that's helpful. Just play with that. And you can, I would say it's important to do general tapping all over, maybe once a week. If you're just starting, do it 3 times a week. Just start to get connected in yourself. Because, a lot of people will just, if they're having back pain, they'll just do maybe tapping on their low back. But that's not, you want your whole system to come to life. Not just the area that you feel the pain. Because like I tell my clients often, is that pain is usually the end point of strain. That's not perfect. It's not perfect science. But it's enough to help people say, oh, you mean there might be other things involved? Yeah, there might be a lot more involved. But let's just start there. Start with the big picture. Always have the big picture. Don't let people, or even your own brain, even your own self, what you've learned from society, don't let those contract you into, focusing on one thing. We've been focusing, we've had specialists for the longest time. But I guarantee those specialists get more limited, and they even become taken advantage of. They even become taken advantage of in themselves. So for instance, what does that mean? Like a doctor might go to school with very good intentions. He might go to school with very good intentions. Then he needs to pay his school bills. He needs to live life, all the stuff, right? And so what does that mean? Well, then what it means is I'm going to get this job and I'm going to do all my things that I need to do. And so he used to have this idea of helping a lot of people. Now, because he's got this job, he has to follow the protocols of the hospital. And the hospital, for low back pain, they mostly have drugs and surgery. Because that pays out, right? That's not what we want to do here. Because that's not what's happening in science. And that's not the reality for most people. They don't need drugs and surgery for most orthopedic, neuromuscular stuff, right? So medicine evolution, I hope that's helpful. Like like the video, put comments in there if you have questions, and let's go.